here this hour, there have been calls to exempt medical facilities from Eskom power cuts. Health Minister Phaahla has outlined plans in that process. Heidi Giokos is following developments and joins us with the latest. Good morning, Heidi. What's the status of hospitals being exempt from load shedding currently?
Yes, before I get into that, Fundo, I'm just going to ask my colleague Mbudzeni to just show you the Health Minister is currently at Witbank Hospital, and he is going to be doing a walkabout. We tried to get him quickly just before his walkabout, but they want him to, of course, go through the hospital first before he speaks on any of that. But I think what's important to highlight here is that there's a very crucial aspect at play here, and this has got to do with load shedding and how hospitals, there's a call for hospitals to be exempt from load shedding. Now, what's worrying here is that only 10% of hospitals nationally have been exempt from the load shedding schedule. And the Health Minister saying that what they want is for it to be 100% of the hospitals to be exempt from load shedding. But they are only currently sitting at about 10%, 37 hospitals out of the, over 300 hospitals. And what's also alarming is the fact that the hospitals that are not exempt from load shedding have basically run out of their diesel budget for the year. So the diesel that's used to run the generators when load shedding has kicked in. I think it's safe to say, Mfundo, that South Africans have been subjected to the worst load shedding this year, especially the month of September. We were subjected to stage 6 load shedding. So hospitals are really going through their diesel budget very fast, and National Treasury is going to be approached by the National Department of Health to try and get more money to fund these generators at these hospitals until they can come to an agreement with Eskom and municipalities to exempt hospitals across the country from load shedding. But let's listen to the Health Minister, Dr. Phaahla, on this worrying issue of the diesel budget being run out already.
All right, Heidi, unfortunately, we don't have that particular bite from the minister around diesel. But what does he say will be the alternatives? Because honestly, I must say, most citizens were probably not aware when we first broke the story. It seemed many were not aware that hospitals were in fact not exempt from power cuts. So it was quite a big storm on social media where they're all furious, honestly. So what does he say are the alternatives?
Yes, I think what's also important to highlight here is that according to the Health Minister, the DG and the Deputy Health Minister, they have received no reports that anybody has passed on in a hospital due to load shedding. So whether they were on a ventilator or in ICU, or wherever they were in the hospital, according to the Health Minister and the National Department of Health, nobody has passed on because of load shedding, which I think is some good news. But the National Health Department is going to have to find a way to find alternatives, because this is worrying, and until they find a sustainable solution, they are going to have to find another option to keep the lights on and electricity going in these hospitals. The Health Minister is saying that they are looking at renewable energy, so for example solar panels to be put in hospitals so that they can have some kind of electricity supply. What's worrying here, Mfundo, is that even if hospitals have generators, they can't keep everything on in the hospital. So there's also a safety issue here at play, where healthcare practitioners are a bit worried. Security guards are unable to patrol the full premises of hospitals. People get mugged when they get into the parking lots of a hospital, going into the emergency section or whatever section of the hospital. So there are a number of aspects that the National Department Health Department has to look at, and one of it is renewable energy such as solar.
And we actually do have the minister speaking on renewable energy. Let's listen in.
Want to include renewable energy already, as we're discussing here in Witbank, one of the hospitals which is being constructed. They already showed us pictures, and I'm looking forward to visit the new Mapulaneng Bushbuck Ridge Hospital, which is being constructed, where they already put some solar panels as part of the plan for the hospital. But the detailed more work is being done to make sure that in future all our hospitals should have a mix with all these solar panels, also array of batteries, with storage batteries, which should be able to contribute to uninterrupted power supply.
It's commendable that they are looking into those renewables, but honestly still so surreal that this has become our reality, where we're just getting constant blackouts in the whole of the country, and particularly hospitals. When we look at Witbank, where you are today, that particular hospital is not exempt. Talk to us about the situation that they're dealing with currently.
Yes, so this hospital is not exempt, and I keep telling everybody I come across them, Funda, but I was actually born in Witbank Hospital, and it's rather sad to see the state of this hospital. It's deteriorated over the years. It's been a very concerning hospital, and this is possibly why the Health Minister, Dr. Phaahla, has decided to come to this hospital to see the state of this hospital. You have seen shocking stories on social media of people saying that if you go into Witbank Hospital, the chances of you coming out alive are very slim because they are under-resourced. As you mentioned, they are not exempt from load shedding. Whether they have enough generation capacity to keep the lights on when there is load shedding is probably something the minister is going to establish. But it is a concerning hospital, and there's a lot that the minister needs to look into when it comes to resources, when it comes to refurbishments of this hospital. This hospital is in a very bad state, and I was speaking to an official, I'm not sure who he was, and I said to him, I'm so shocked about the state of this hospital, and he said, why? Because the roof is not painted. And I said, it's more than just a roof being painted. It's got to do with the fact that this hospital has not been looked after, and it caters to a large number of people. I think this is one of the main government hospitals in eMalahleni, and the others are private, and then there are other healthcare facilities that the health minister will be attending to. But we do know he is on his walkabouts, and we'll definitely be asking him what plans there are in place to assist the staff here, but also to make sure that this hospital provides the services to the most vulnerable in our society.
Let's hope that his visit does in fact yield positive results for the residents of eMalahleni. Thank you very much for that update. That's reporter Heidi Giokos, who's in eMalahleni at the Witbank Hospital for us this morning. Back to